Hello, everyone. Welcome to Arash's World. Today we have a very special guest. We have Dr. Ludwig Janus with us. How are you doing today?
Yeah, very well. Some old, a little old, but good, in good condition.
In good spirit, and that's that's
Yeah,
that's really
yeah,
important.
good spirit. Yeah,
Now, how would you briefly describe yourself? And I always ask all my guests here, what would you say about yourself? And I'm very fascinated
yeah,
to hear what you have to say.
yeah. I am born 39, 1939, and had a psychoanalytic education, but then other experiences in humanistic psychology, like regression therapy and psychodrama and others. And then I got discovered the extraordinary meaning of Otto Rank in his research of our prenatal experiences. That for the normal doctor was ähm, Amnesia, frühkindliche early child amnesia. Aber it is not amnesia, it is a whole rich experience, but preverbal, spared in our emotional and sensorical memory. And there is the Society for Prenatal Psychology, and I got became president of the society, and we have an active international exchanges about prenatal psychology.
That is
Mhm.
wonderful.
And
And
also
mhm.
psychohistory, but it's not important on the individual level, but also on the collective level.
It is fascinating, and for me, also how you introduce yourself with being born, and I think that is very fascinating because our story begins with being born, but it actually begins before being born, and so the pregnancy itself is so important, is so vital. And
Yeah.
your book that you have, The Enduring Effects of Prenatal Experiences, Echoes from the Womb.
Yeah.
I love the title, and especially the second part, Echoes from the Womb, is very poetic. And I
Yeah.
find it also interesting when I was discovering Rank for myself, who I'm fascinated with, when he talks about the womb, and then that's the trauma, the beginning of trauma for us, and how that experience is traumatic. And it's interesting with I like wordplay. So in English, the word womb also rhymes with tomb. So when we go into that same place, the dark place,
Yeah.
we come from a dark place and we go to a dark place, and then we have a life
Yeah.
all in between. So I would
Mhm.
be very fascinated to talk about pregnancy, the importance of it, not just in terms of the experience biological processes, but also psychological processes, because it's so important to our lives as well.
Mhm. Yes. Mhm.
So how is it that it's really like shaping us to hear the connection with between the prenatal experience you mentioned preverbal, which is something I'd really like to look
Mhm.
at, the experience of trauma, as well as perinatal. So what the first year of life that is so crucial. What are some things that could happen? What are some things we should watch out for? And when things go wrong, what can we do about it? So there's a whole lot
Yes.
of questions. Yeah.
Yes. Also the interesting thing is that Rank discovered the importance of our birth experience as a dramatic change of a one prenatal world, mother connected, to an outer real world. Uh, that is a big event in our life.
Which we
But
don't
he
remember consciously. I think that's
Yeah,
important
it is
too.
a
Yeah.
probable experience by all of us,
Yes.
but not on the speech level, but on the experiential emotional level. And it is interesting. There was a 2-year-long fight between Rank and Freud
Mhm.
about the relevance of this experience.
Mhm.
And Freud said, because he was a denying of the mother importance of mother at that time, men were the godlike beings on earth. and
The focus on the father, which Freud
woman
does. Yeah.
are not exposed.
Yeah.
And he said birth cannot be so important. What is important, and that was his discovery, the unripeness. We are born too early. He said our pregnancy is shortened. We come to the world in an unripe condition. And this discovery explains much. And this was proven on a biological level by a man, Adolf Portmann. He spoke of the physiological prematurity.
Mhm.
As we come to the world, but we are not able to handle the world.
Mhm.
The little elephant comes to the world, goes on his legs,
Yeah. Yeah.
finds his mother. He has an orientation in space
Mhm.
and can be an active part of the elephant's community.
Mhm.
We are born helpless. We cannot move in anything.
No, we can't feed
But
ourselves. We can't do anything. Yeah.
we have to manage this outer world. And this is the special thing. We develop our autonomy, but we can say also our ego in the relation to the mother or father
Mhm.
on this unripe level.
Mhm.
It's more dreamlike consciousness.
Mhm.
A mother, father are God, goddess,
Mhm.
not personal beings in
Mhm.
the reality. And when we go, and all this is stored in the right brain hemisphere, no, on the preverbal level. And then the dominance part of the brain goes to the left. There's the speech center. And when we are 2 years, 3 years, we learn to speak and we speak over the things of the child with 3 years,
Mhm.
not about my birth experience or so. But we have an imagination of this early experience, and these are the contents of the religion. As we have in Christianity, the myth of the paradise, we come from another world, and there was a very difficult thing, and we had fallen down on earth.
Mhm.
That is a dreamlike imagination of the prenatal, perinatal, postnatal reality. We all have lived in another world together with a higher being. And now we can reflect this religious imagination as a real happening in our life. And it is interesting, these myths about paradise and sin and fall and so are accepted because all have the feeling there can't be any truth in this. But it is not personal. It's not my personal pregnancy experience, perinatal experience, and early first year experience. And that is new prenatal research, and Rank was the first to discover this, is to get access to the pre-verbal experience stored in my emotions, imagines, and feelings, sensations, and so on.
Mhm. And it reminds me also of Gnosticism, the idea of Sophia, the mother, and then how that's the mother of God. And that's what some people say. So that kind of connection, and I love the connection again with paradise and the womb, because you are in
Yeah.
this safety and comfort. It is you're floating, you're being fed, you're warm, and then suddenly you're going through this tunnel and you see light, but then the world outside is cold and you're separated from the one that was nurturing you. And so
Yeah.
that kind of longing and that kind of connection is so important because you don't know what's going on as a baby. And so again, as you say, our speech starts at 2. Our brain does not remember anything before age of 2 in terms of like concrete images,
Yeah.
I think. At least unconsciously, it's there with us. but how to deal with that kind of trauma that we experience, and we all experience as human beings. And human beings are strange in the sense that we take such a long time to develop in the pregnancy and trying to become independent as compared to other animals. So I find that fascinating too. But I also find it interesting in the correlation between anxiety and the birth, because when we're anxious, we go in a fetal position. It's like kind of going back to that moment, or we're out of breath because we did
Yeah.
not have breath when we came to the
Mm.
world. And the first cry is like so important too, of like announcing your
Mm.
existence, your
Mm.
coming into the world with a shout, a
Mm.
cry. Yeah.
Mm. And it is interesting. First, Freud said there is this unconscious experience of the little child. In us are the emotions of the child. And then the next step was Alfred Adler, who said behind the Oedipus complex is the minority complex.
Mm.
And the minority complex is a consequence of bad conditions of my mother.
Mm.
He said it in very clear words. Poor workers, woman at the age in a factory in 1900 and so on, was depressed, was socially marginalized,
Mhm.
and was in a situation of minority. And this was transmitted to the child. Also the time before birth is not always heaven, but sometimes birth. And if the mother is in bad condition, you have this minority complex. And Freud was a very expected child. His golden Siggy,
Mm-hmm.
the dream of mother, a Jewish mother, has it worse because he has born a son. And therefore, the hopes of the love of was to the golden city, golden Ziggy, and Adler was coming from poor people. He knew the misery of normal life, and he knew the misery of the woman, and he knew the misery of the children at that time. Mm.
And it's all fascinating with Adler though, because that's that drive. As like when you are in that minority and you feel like you work harder
Yeah,
in many ways, and you try to prove yourself. So in a way, you can also see it in a positive way as a drive where you say, I have to prove myself, and you work hard. But
yeah,
absolutely, there's that lingering feeling that you might never feel enough, and you might never
yeah.
be like part of it and be fully accepted.
And it is very strange that Adler was uh, marginalized
Marginalized, yeah.
in the history of psychotherapy, and he this drive to power. That you have the drive to power to be not in such a bad situation that you have been before birth or after birth. And this deep anxiety and misery feeling
Mhm.
of bad conditions of mother, pregnancy, and birth, you want never to experience again. And therefore you make big,
Mhm.
and the others shall be
Mhm.
the poor man. And that is important, a big importance. In Russia, we have a very toxified society, violence in the history, Stalinistic, Tsaristic regimes, murderous regimes, and misery from in the history. And therefore they have, and Putin, his background is very cruel in the war condition of the mother of his parents, and therefore he has deep anxieties, paranoid anxieties to be killed, and therefore he kills he has the idea, the crazy idea that the Ukrainians have the plan to genocide the Russians. That is very fantastic. And therefore he makes this war. It's a self-hate in himself.
Mhm.
And all these things were strange for the Golden Ziggy. he want, he wanted to speak with Einstein and Roman and with the heads of the society, but
Yeah.
not with this anxious and poor people. Mm.
Yeah, and I love it how Rank talks about that too, of like seeing the other as a threat. But when you kill the other, you get a sense of immortality because you think like my people, and that kind of division too. It's like these are the Russian people, these are the Ukrainians, these are, and so when you
Yeah,
look at that difference, when we see polarized societies everywhere around the world, and that's because you want your tribe to survive, and you by killing the other, you think that you beat you
yeah,
became immortal and you beat them, and that's
yeah.
you can't
Mm.
beat death because that's the reality that we will all experience. And I love how Rank looks at that, the fear of death, but also the fear of life itself, that we're afraid of
Yeah.
fully living, of experiencing things, and that's why we're often in a comfort zone and we don't move along. And a lot of it can
Mm.
be traced back perhaps to our childhood and even earlier to our prenatal experiences
Mm.
as well.
And to understand these connections is so important because by better the situation of mothers in their relation and parents in their relation to their children, better the world.
Mhm.
Happy children don't make wars.
Exactly.
And no happy child wants to kill anyone.
Mhm.
All the murderers, there are interviews with mothers of murderers. They say they had catastrophic
Mhm.
pregnancies.
Yes.
Although for these murderers, her primal experience was hell. And in their lives, they create hell for others and themselves.
Mhm.
And it is a simple connection. And therefore, we have the big tool to change the world.
Mhm.
The first thing, we are in this change
Mhm.
because we have the emancipation of women,
Mhm.
the balance, equality in man-woman relationships. And this is the big advance that we have. And therefore, there is an empathy in the between mother and child.
Yeah.
It is crazy to realize that the children of my generation, to a great part, were beaten as children.
Mhm.
If you, it is, and now nobody beats his child. In earlier times, it was self-understanding.
Mhm.
If the child does not follow, you beat the child.
Mhm.
And this destroys his soul, the soul. And in Russia, there is, in the families, there is a big violence. And all these very big leaders, Stalin, Hitler, were beaten children, beaten child. And therefore, all this is very, we have the knowledge to better the world. That is
Yeah.
wonderful.
Yeah. What helps us too is with evolution, we have a very positive feeling towards generally towards pregnant pregnancies and pregnant women. And so
Yeah,
this kind of this sense of protection we have unconsciously, I would say even, and that's like programmed in us evolutionary. So that's a benefit that we should really take advantage of and always like try to help and support, and as well the relationship between the mother and the baby inside. It should be again one of love, one of experiencing less stress if possible. And I'm thinking of all the pregnant women right now who are going through wars that are happening in the world, and I'm thinking of those unborn children. I mean, this is traumatic. And so we are, as you're saying, the answer is there, but we are also propagating a lot of misery in the world by doing these wars, this violence, and so on, which is again having all these effects on people who are not even born yet.
Mm. And the important noun for this in German is Verantwortung. What's in English, Verantwortung?
Accountability.
Responsiveness.
Yeah.
And the main thing, or our main task, to be responsible for our actions,
yes,
for our relations, and to be in respect of the consequences, what we do. And now we start to realize that responsibility is the main thing.
Yes, yes.
And Putin has no idea of responsibility.
Yeah.
He is acting out his misery.
Yeah.
And others. But Biden has this. I found it interesting that Biden says Putin has no soul. He felt that this man was a hidden criminal. He felt it.
Yeah.
But he takes no responsibility what he is doing. But
yeah.
It's our task to do it in the small sect of our, Therefore, we have this democracy that enables us to be responsible.
And I want to look at therapy too, of how can we go through that. So somebody like Putin, as you're mentioning, how can they heal from it or get better? What are different? You use art therapy. There's also the catharsis regression therapy, which I find quite interesting. Can we talk a little bit about that? What they are, and then what are some of the benefits of that too, of how to use that to heal from these wounds that we have or the trauma.
One psychoanalysis had the so-called Lehranalyse, teaching analysis or so, self-experience. To understand the patient, you have to make have to understand yourself.
Yes.
But if you don't, on the Freudian level, you have an understanding for the little 3-year-old boy or a girl. But on the Rankian level, you need an understanding of the baby you have been, or the prenatal child, or the birth experience. And this, you can get this by regression therapy, primal therapy, growth therapy, and other therapies. But by these therapies, and also by reading Rank, you get a broader understanding, and if this is the main thing. If you make primal therapy without understanding these connections, it is nonsense. You need this broader understanding. And if you have made this regression therapy, or you have this broader understanding that your birth experience or a prenatal is real experience living in you, you can get in connection with this. And then it is not necessary to take LSD, as Groff said, or to make this primal therapy sessions. It is, you can understand if a patient is touching his head and has suffocated. You can see, empathy. You have empathy that is reliving certain aspects of his birth or other things, maybe a navel cord on the neck, and other things. If a baby is always touching the head, you understand the baby wants to show the misery of coming about the symphysis had brain pain, scalp brain, brain on the head, pain on the head by coming through the birth channel and so on. And then you can accompany by empathy with broadened consciousness and self-awareness, you can accompany a patient through this. This is your go in these feelings, feel this anxiety, relates it to the old situation and not to the actual situation. Also there are patients or persons who have anxious in tunnels, and they make a shortcut with the rear tunnel, the birth channel. And only this clearing of this mismatching of tunnel and birth channel can make a change in the inner condition
and epigenetics
can help to come out. Also there is a problem if you have only difficult birth situation and you have a tunnel anxiety or something like
choking,
breath problems, then only this explanation and accompanying in the feeling can help and solve the problem. But many people have several traumas. They were unwanted. That is the most big problem, because the first word is the mother. If you are unwanted, you have no right to exist, but you need the right to exist in the whole life. But if the right to exist is denied, you has this minority complex. I have to leave. It's better I'm not there. And this is a burden on the shadow on your life. We have a big problem of the one side medical orientation of the obstetrical clinics. They say pregnancies and birth are natural events, and the mother and the child have the life power to realize this. And it is a man-dominated situation. If you are pregnant, you have a problem. And there can this disaster, that disaster, and I only the big doctor. You have to rely on the big doctor, and the mother is breaking down, and then she is anxious and goes in the clinic, birth clinic, with anxiety, and then comes the next doctor and says, "No problem, we take over, we make the birth, we hang." Zange. We have many interventions and make a narcosis, and this is a big trauma for mother and child. And William Emerson has written a book on this, birth trauma, in Deutsch Geburtstrauma, the consequences of these medical interventions. This is a big burden in our society, because if you have these interventions, intervention means help at normal birth, vaginal birth. You are the hero's quest. You are the hero. He creates the transition to the world. You like a godlike being, a hero. But if you have this intervention, you feel helpless. You are nothing. I need help of the doctor, help of the authority, help, and so, and with I have this minority complex, and so, and therefore I became neurotic, helplessness, anxious, and so on.
What about premature
and
babies?
Therefore, we have to change this obstetrician clinic.
What about premature babies though? Because they are again before time and they're taken out. They're not. It's not the natural path, like cesarean C-section usually. So is that it must affect them too when they're premature, right?
Ja, genau. Also it is you have always to see both sides. In earlier times, many mothers and children died.
Yeah.
It was normal. Birth and pregnancy were life dangerous for the woman. Also half in Bavaria, southern Germany, half of the babies died in the first year of life.
Yeah.
That this was a misery in the families. Modern knowledge of anatomy and birth process and the medical knowledge helped. You can now survive. But it is important to have the psychological aspects of the dangerous surviving or the dangerous impacts of this medical surviving. And prematurity is the same. Early births, also early birth, short pregnancy means in earlier times death for the child. Now you can, in the birth incubator and so on, survive, but have deep, painful memories on this.
In
But
terms of
nowadays we
development,
have, yeah, we have baby therapy, and so we have knowledge to help babies, your little children, to in Deutsch verstoffwechseln, to handle these painful feelings.
But they usually make up though, even though they start off like behind, they usually make up for it in terms of growth and development, the premature babies. Is that correct? So the brain develops like at a faster rate than to catch up. And so in
Yeah.
many ways, they are probably able to recreate and just get rid of the deficit that they have because of, again, coming early.
And we in Heidelberg, I'm pride on the one thing. In earlier times, when this intensive medicine that was discovered for the adults, you can take over by the doctor basic functions of breathing by artificial breathing and so on. And this was adapted to the handling of premature children. They cannot breathe, and you can artificial breathing. But this separation of mothers is a basic fault, and because the child it is essential to breathe, to able to breathe, but to have oxygen, but it's to have contact. You only without contact, you would have no feeling. You have feel alien in the world. And there was this bringing the child to the body of the mother or on the father. Das ist, do you know the name for this? Also, the little child did not come in the incubator, but on the body of the mother or the child. And this was partly also invented, introduced in the handling of premature baby in Germany, in Heidelberg, together with the man Otwin Linderkamp. And he had a connection to prenatal psychology and my conferences, and realized this bringing early contact situation. Right? And then the people, many of the babies can breathe by themselves if they are in contact. They need not the breathing machine.
I find that fascinating. I want to go back to what you're saying also about earlier through like fears and anxiety. And so when we use, I used self-analysis. So I looked at various things in my life and just things became clearer. Like when you make the unconscious conscious, you find out what's driving you. Why is it I'm scared of this? What's causing my anxiety and fear? And I was able to deal with a lot of them. And I used to suffer from sleep apnea, which now has gone away. now that I've dealt with my anxieties and fears and so on. And
Mm,
so that connection too with the mind and the body. And one of the issues I have with Freud when he talks about insight and epiphany, which I think is very important once you have that. But what's the next step? Because it just seems to be cognitive. It's like, oh, I know what's wrong with the world. I know what's wrong with this. I read Rank and I understand it. But then to apply it to the body as well, that kind of combination of both. And once you do that, I find I had catharsis. Once I discharge all these like emotions that I have, these fears, I realize them. I become freer and I become happier and I become healthier as well in many ways with my body
mm.
too.
Yeah,
And that's
yeah.
fascinating. Yeah.
We have to integrate all these
Yes.
levels. You have to respect. Freud was born in German Kaiserreich,
Oh, yeah.
Kaiser with the
Emperors, time of the emperors.
emperor. Only the man and the authority, the male
Mm.
authority was important.
Yeah.
And he had not, that relation is important. That was invented by Rank, the
Mhm.
relation, and also with mother and child and mother and baby and the prenatal relation. And we have this really a progress
Mhm.
in our understanding ourselves and what is important in life.
Mhm.
And if we are in relation, we are we have an autonomy.
Mhm.
If you are dependent to an authority, you there is no autonomy. You have to follow your master.
Mhm.
And in earlier times, you had to follow God to follow the bishop. But today, we have to take responsibility for ourselves. And it is possible. It is possible. We
It's
can
also
use the
mhm.
knowledge, or not only for, in earlier times, it was you had if you were ill, you get access to psychotherapy.
Mhm.
But it is important to access to self-understanding for everybody.
Mhm.
Therefore, we have today this coaching.
Yeah.
But I think we in our school should be 1/3 learning to live,
Mhm.
learning about relation, learning about conflicts, learning about fatherhood, and so on.
Mhm.
1/3. I learned only Latin, mathematics, running, sport.
Mhm.
It's it's not sufficient to live.
No, it's not.
It's
No,
not
no.
sufficient. I had it during my life to learn. Oh, oh, there's important relations important. Love is important.
Mhm.
So
Mhm. Yeah.
conflicts and resolution is important. Responsibility is important.
Yeah, yeah. I
Yeah,
grew up in Germany, so it was discipline, and they taught me good discipline. But what about the rest? What about all the other things in life? You know, discipline is important, but there's so much more to life than that.
yeah,
And
yeah.
I think what I liked in nowadays is the respect for children. So that's kind of growing nowadays, where
Yeah,
it's we're accepting them a bit more. We are trying to understand the worldview. And for my son, I always taught him it's like I'm not the father telling you what to do. I explain things,
yeah.
I reason with you, which backfires because now he has these counter arguments that are very good. It's like, Dad, but this and this, and it's like you're right, you know, and
Mm,
accepting that we are not gods or authorities or emperors as
yeah,
parents, and
yeah,
being
yeah.
vulnerable to that. That is going in the right direction in many ways. So we're not disciplining in the bad sense, disciplining and punishing our kids, but working with them, dealing with them, talking to them. That's really important.
And if there's peace in the family,
Yes.
there's peace in the society.
Yes.
And a special thing is, I want to mention, is the Förderung the support the mothers in their relation to the child
Mhm.
before birth. It's called bonding analysis.
Oh, cool.
There's also in APA, in the American Society for Prenatal Psychology, there are courses about bonding analysis. Um, the name it's supporting the prenatal relation of mother and child, And we have a big book, Handbook of Prenatal and Perinatal Psychology. And in this book, there are articles about prenatal bonding. And also in the Journal of the American Society for Prenatal Psychology, APA, there is an article in the last year about prenatal bonding and how helpful it is. If there is a connection to the child and connections, empathy, Einfühlung, between mother and child before birth, the child has a feeling of existence. A basic autonomy. I am in the cosmos, but it is wonderful to be in the cosmos, and I am accepted. Wonderful. Then I can accept my life, myself, and you, and the experience of birth. Then is a big adventure because you have this self-confidence, the basic self-esteem, and there you can go. And you can go to the birth process without losing yourself. That is interesting. That is a quote from Rank. Being born without losing yourself. We have to beware our basic self-esteem through the transition to the outer world. And then we can have the feeling of being welcome, and we can start our life.
And once we do
and
that,
we need, and we need parents to that accompany us. Also, you are accepted as a baby and a 3-year-old girl or a child, and so we need to accompany the accompany of the parents up to adulthood. That is the challenge of parenthood.
Yes, that is.
It's a big challenge. It's a big challenge to be father or mother.
It's an existential challenge, yeah.
Existential.
The bonding starts off, it's so important, but then we connect with others. We connect with fellow beings. We connect with our earth. And if you think of the earth and the cosmos as like the womb, the cosmos, the universe is the womb, and we're safe in it, we're warm in it. If we perceive the world like that, the sense of calm and tranquility will come, and we will be happier, and we will cause less violence in the world, and less division and more unity. It's such a pleasure talking to you, Dr. Ludwig Janus. You're a psychoanalyst, psychotherapist, author. Your book is, again, The Enduring Effects of Prenatal Experiences, Echoes from the Womb. The book you mentioned, you're an editor of, it's called A Handbook of Prenatal and Perinatal Psychology, Integrating Research and Practice. And the book that you also, we talked about a bit too, is Other Ranks the Trauma of Birth, which I like to call the birth of trauma, right? So kind of switching it around, but it's the same thing. So also a very influential book that was published 100 years ago. So fascinating stuff, excellent books. Thank you so much for this fascinating discussion, Dr. Janus. It's such a pleasure talking to you.
Thank you very much for the opportunity. Thank you.